We'll get started with today's events. Good afternoon, everyone. Neurology itself deals with the diagnosis and treatment of all categories and conditions involving the brain, the spinal cord, and the nerves. Everyone from budding doctors such as yourself to experienced physicians strive every day to understand the intricacies and beauty of this fascinating branch of medicine. Although it is vast, it is also a very captivating and logical subject. On that note, it gives me great pleasure to welcome you all to Neuro Quest on this date, 9th of November 2022. I'm Dr. Prajakta Patil from the Department of Medicine, and I'm here to guide you through this quest for knowledge. 6 teams of undergraduate MBBS students from various medical colleges around the region will compete for the fame, the glory, and yes, even a little bit of prizes. So to start off the event, I'd like to request Dr. Supriya Barsore ma'am, who is Professor and Head of Department of Medicine at Bharti Hospital, to please grace us with her presence on stage and give us a few words of encouragement.
Good afternoon, everyone. On behalf of the Department of, sorry, one second. Good afternoon, everyone. On the behalf of the Departments of Medicine and Neurology, I'm pleased to welcome you all to the Neuro Quest 2022. It gives me great pleasure to see many earnest faces in the audience and in the teams today. And I wish you all the very best for the quiz. Thank you.
Thank you, ma'am. Next, I'd like to request Dr. S.P. Gorthi, Professor and Head of Department of Neurology at Bharti Hospital, to please take a seat on stage. And if ma'am can please take a seat on the stage. We are honored as a group today to have a few dignitaries in the audience. We all know them very well. Today, I'd like to request Dr. Mandar Karmarkar, our dear principal of Bharti Vidyapeeth Medical College and professor of Forensic Medicine Department, to please join us on the stage. I'd like to request Dr. Sanjay Lalwani, sir, Medical Director of Bharti Hospital and Research Center and Professor and Head of Department of Pediatrics, to please join us on the stage. Next, I'd like to request Dr. Akhil Nagpal, sir, Director of Super Speciality Services at Bharti Hospital and Research Center and Professor and Head of Medical Gastroenterology, to please join us on the stage. Now, if I may please request Dr. Gorthi, sir, to introduce our judges for the quiz and request them to take their place on the stage.
Good afternoon, students. For this exciting event and quiz, we got judges who are very well known, renowned. The first one is Dr. Winnie Wilson, who is a professor of neurology and medicine in FMC. Winnie, will you please come and join on the stage? And the other judges are en route. They are stuck in the traffic. One is Dr. Shripad Pujari, who is a very well-known neurologist. And another one is Dr. Sudhir Kotari. So they are going to join us in due course of time while the proceedings start.
Thank you, sir, and thank you to all who are seated on the stage. Now, as is tradition, we will now proceed with the lighting of the lamp to begin the quiz in an auspicious manner. Light is the universal symbol of prosperity, positivity, and wisdom, and we welcome the warm, bright glow of the diya to wash over us as we embark on this quest for knowledge. I'd like to request the dignitaries to please rise and come together for the lighting of the lamp and then resume their seats on the stage. So I think while we wait, can I see a hand from who all here is from first MBBS? What about exams? Good. What about second MBBS? Okay, tell me which, which part of MBBS you are from. Third MBBS, part 1, part 2, great. Part 1, part 2, okay. How are studies going along? I know neurology is probably the best topic in medicine, right? There will be audience interaction, so I hope you've brushed up on your neurology before coming here. Yes. Okay, will you have silence now, please? Thank you, dignitaries. We would be honored to felicitate the dignitaries and request if they would each say a few words of good wishes for the participants before resuming their seats in the audience. I would request Dr. Supriya Barsore ma'am to please felicitate Dr. Mandar Karmarkar sir. I'd like to request Gorthi sir to please felicitate Dr. Lalwani sir. Next, I'd like to request Sangle Madam, Professor of Department of Medicine, to please felicitate Dr. Nagpal sir. Next, I'd like to request Dr. Sudhum Rekar, who is HOD of Neurosurgery, to please felicitate our judge, Dr. Vinnie Wilson. Thank you all dignitaries. You may please resume your seat back in the audience. Karmarkar sir, we'd like to request if you would like to give some good wishes for... Please sir. So, oh,
Good afternoon. First, I must congratulate the Department of Medicine and Department of Neurology for organizing Neuro Quest 2022. I personally think so. An undergraduate quiz is one of the most important vehicle to infuse the enthusiasm about the subject in an undergraduate, because I remember Indian Academy of Pediatric runs a regular undergraduate quiz for last 22 years, and it's one of the most popular activities among the undergraduate students. That's number one. Number two, I must congratulate Dr. Gorthi. He may look 60 plus, but his enthusiasm is to a 20 plus young undergraduate doctors. He's full of zeal, enthusiasm, and keeps on organizing various such activities to keep the interest of neurology live among undergraduates, postgraduates, super specialists, and I think he's a teacher par excellence in the field of neurology. I'm sure uh, no other subspecialty in Bharati has had so many programs conducted on various platforms, what the neurology has done. And I'm sure we would witness more program, and I am quite sure that neurology as a subject has already been popular, but it always depends upon the teachers to make it more interesting and more appealing to the students. I'm sure this Neuro Quest would create interest of neurology of in few of you who are in the audience, so you may look at neurology as your career options in years to come. I wish all the participants, the judges, and both the head of departments and their faculty members all the best to organizing such activities, and should see more of them in years to come. Thank you.
thank you sir for your kind and encouraging words. I'd like to request Dr. Nagpal sir if he'd be able to give us some good wishes for the program today. Yeah, it will take time, sir. Sir, yeah,
So it's very heartening to see that the Department of Neurology has taken this initiative and rapid strides are being made to further the cause for neurology and infuse the interest of neurology in the students. Now, as Dr. Lalwani also pointed out, that that the Department of Neurology has been very proactive as far as all academic activities are concerned, and this is one such. And I'm also very heartened to see that there were 12 teams who made a bid for this, and now I think 6 are going to be shortlisted. So the response has been tremendous. And quizzes happen to be a very innovative form of teaching learning methodology. It takes you away from the boredom and the monotony of a classroom didactic teaching. It makes you come in the interactive and a participative and a very enjoyable kind of a atmosphere. And this is not only to test your knowledge and be an assessment tool, but is also to disseminate the interest amongst you so that some of you are turned into budding neurologists. So with those words, I think we are all waiting, and I hope this promises to be a very good academic feast. And do you have participation from the audience also? Yeah. Thank you so much.
Thank you so much, sir, for your encouraging words. I'd like to request Gorti sir if he'd like to say a few words and to introduce our judge.
Thank you all the senior members who have graced the occasion. And we have been just joined by Dr. Sripad Pujari, who's another co-judge to this event, and he's going to conduct one of the rounds of the quiz. Okay, why we are celebrating this or commemorating this on the occasion of World Stroke Day, which happened to be on October 29th. As you all know, this year we had Diwali and so many holidays, so we could not hold it in appropriately on that day. That day we had a Zoom meeting, but to commemorate World Stroke Day, which has been started in 2006, every year we organize this program. If you remember, last year we have organized a seminar on stroke. This year we wanted to expand, and in addition to stroke, we have also included the general neurology. The quiz, as Dr. Nagpal said, is a method of learning also. People who may not do well in the quiz need not be disappointed, because every question is given with a take-home message or knowledge. So try and imbibe that. So we have 4 rounds of quiz here. One is a stroke round. First round is stroke. That second round we have a clue round, and third round rapid fire and buzzer round. So at the end of the 4 rounds, the winners will be given the prizes, which will be further elucidated by Dr. Nitin Gadkari, who is going to be, who is our chief coordinator. And I thank all Department of Medicine, Bursada Madam, and all the faculty in the Department of Medicine, along with my faculty in the neurology, who have helped in coming to know this exciting event, and it has seen the light of the day. So students, we will have a exciting 1 hour time, and we'll have the quiz started. Dr. Nitin, may I ask you to come and start?
Hello. Thank you so much. I welcome you all. And I would now like to call upon the teams to get seated over here. First, I would like to invite Shubham and team from Dr. D.Y. Medical College, D.Y. Patil Medical College. So the tables are arranged in the format. This is table A, B, C, D, E, and F, like that. Okay? A, B, C, D, E, and F. So you can please come and pick your chit, and then you can sit on your table. B, please sit here. You can introduce yourself to the audience. Second, I would request Akshat Khare and Riya Singh from AFMC to please come and pick up the chits. Your team F there. Then I would like Piyush Jaju and Mihir Lahoti from BJMC Medical College. Team E, please here. I would like to request Advait Melankari and Joseph from Bharati Vidyapit Medical College. Please pick the chit. Team C, this side. Now I would like Alisha Sheikh and Param Kadam from Maimar Medical College to pick up the chit. Team D, please sit here. And last is Team A, which is Amod and Meg from SKNMC College. Now I would request Dr. Gorthi sir to felicitate Dr. Pujari sir. Okay, so as sir has already explained, there will be 4 rounds to this quiz. The first round will be called as the stroke round because we are celebrating this quiz in the commemoration of World Stroke Day, which was on 29th of October. So there, every team will be asked around 4 questions. It will be a single best response type of a question. If any team is not able to answer that, then that question directly passes on to the audience. Audience, if you answer it correctly, you can raise your hand. We can ask you to answer. If you answer it correctly, there are some things for you as well. Okay? Now, let me start a round of introduction from Team A. Team A, can you please introduce yourself? You can sit there. You can use your mics. This is the buzzer. Whenever there is going to be a buzzer round, it is going to be pressed. There is one spotter who will see who has first put the buzzer. Whenever you hit one buzzer, other buzzers are automatically going to deactivate. So as soon as they put, light is going to be there like that. Now everyone is having the light on. So all other are gone and only this buzzer is activated. Again deactivate. Got it? So this is activated for all now. When the buzzer round is there, you just have to press. As soon as one presses, all the other buzzers are going to switch off. Siddharth, इसको off करना. So, can you please start with your name and introduction, your medical college?
My name is Meg Shaligram. I'm from Srimati Kashibai Navale Medical College.
My name is Amod Muzumdar. I'm from Srimati Kashibai Navale Medical College.
My name is Shubham Chuk and I'm from D.Y. Patil Medical College.
Mukta Chittale from D.Y. Patil Medical College.
Johan Joseph from Bharati Vidyapit Medical College.
Advait Melankari from Bharati Vidyapit Medical College.
I'm Param Kadam from Mymar Medical College.
I'm Alisha Sheikh from Mymar Medical College.
I'm Mihir Lahoti from final year BJ Medical College.
Piyush Jaju, BJ Medical College.
I'm Akshat Khare from Armed Forces Medical College.
I'm Riya Singh from Armed Forces Medical College.
So, congratulations for being selected from your college for this prestigious quiz. And now I would request Dr. Gorthi sir and Dr. Vinny sir to please start the stroke round, which is the round 1.
Thank you, Nitin. Dr. Vinny, will you start the stroke round? We'll have 1 response questions here, right? And it will be 4 questions for each. That's what you are going to say. The rules of the stroke round.
Each correct answer is going to give you 10 points. Scorer, please note. Each correct answer is 10 points. There are no negative marks in this round. There are no negative marks in this round. You have to decide which answer you have to give. Only one answer will be acceptable from your team. Okay? So you decide who is going to speak from your team. There should be no overlap. That is number 1. Only one answer has to be given. If you answer it correctly, there are 10 marks. If you answer it wrongly, it is 0. Secondly, there is no negative marking as I told you. And thirdly, if you are not able to answer, the audience gets a chance.
Is it passed to the next team?
No, sir. It passes directly to the audience.
And how much time for a question?
Around 15 to 20 seconds.
Okay, good evening to all of you, the audience. May I ask the audience, how's the Josh? Hi. It's always high in the audience. I request you not to answer the questions that are posed to the contestants. Keep it to yourself, and they will be, the questions will be passed on to you, and there are special gifts for you. And with that, we start the stroke round. The first question goes to Team A. And the question coming to you is, the lenticulostriate branches provide blood supply to all of the following structures except, you have to choose which one, except. You have 10 seconds.
Thalamus.
Yeah, that's the correct answer. So thalamus is supplied by the posterior circulation, so the answer is correct. We move on to the next question addressed to Team B. Are you ready? And the question to you is, a 65-year-old patient with diabetes presents with transient ischemic attack. According to ABCD2 score that assesses stroke risk in someone with TIA, which of the following is not used as a predictor of occurrence of stroke? Which one is not used?
Is it diabetes? Is it age? Is it hypertension? Is it duration of neurological symptoms? Or is it hyperlipidemia?
You have about 10
4.
seconds. Sorry?
4. Duration of symptoms.
That's not the right answer. I'm afraid the question passes to the audience. You can raise your hand.
Yes.
They're in orange shirt.
Okay.
Correct. Excellent.
Excellent.
The question is correctly
And a
answered with the
chocolate
audience.
too.
And the chocolate passes. Is there
Yes.
a chocolate?
Yes, yes.
So good one. So the next question is addressed to Team C. Team C, are you ready? Yeah, the question to you is, a 42-year-old woman with diabetes, hypertension, and hyperlipidemia is brought to the emergency department for unresponsiveness. An MRI was obtained and is shown in the figure. Which of the following will most likely be encountered in this patient?
Is it vertical gaze impairment? Is it hemisensory symptoms? Hemiparesis? Quadriplegia with impaired horizontal gaze? Or aphasia? What is the localization? Depending on the neuroradiology.
Vertical gaze impairment.
Am I right?
The answer is not vertical gaze. The question passes to the audience.
Anybody in the audience? Yes.
So we see Pons involvement and the cerebellum involvement.
Yeah,
So
she is going to answer.
Yeah, who's going to answer? Pons? Yeah. Yes.
Excellent.
So remember, the Pons controls the horizontal eye movements. So the answer 4 is the correct answer. Did you get a chocolate?
Yeah.
So the question passes to Team D. Are you ready, Team D? And the question to you is, a 49-year-old man with history of hypertension presents to the emergency department with acute onset right hemiparesis and aphasia. The time he was last seen normal was about 45 minutes prior to arrival. The NIHSS score is 14. Which of the following is the next step?
Are you going to start IV TPA, get a brain CT scan, give aspirin, start intravenous heparin, or get a brain MRI?
Sir, we'll get a brain CT.
Brain CT, may I ask why?
So we need to rule out if it's a hemorrhagic or ischemic stroke.
Excellent. That's
Excellent
the
answer.
correct
Very
answer. The scorer may please note the
scorer, are you ready? Yeah.
Yeah, the question passes to team E. You ready? And the question is, a 49-year-old woman presents with acute onset hemiplegia progressing to quadriplegia over the next 2 hours. On examination, she seems awake. However, she is unable to verbalize, has increased oral secretions. She cannot move her eyes horizontally, but is able to move them vertically and blink. Which of the following is the most likely cause?
Is it bilateral thalamic infarct, lateral medullary infarct, top of the basilar occlusion, infarct affecting the base of the pons bilaterally, infarct affecting the dorsal midbrain?
Option 4, infarct affecting the base of pons bilaterally.
Okay, that's the correct answer.
What do you call that? Locked-in syndrome.
Locked-in syndrome. So there's a locked-in. Scorers may please note. And the question now is addressed to team
F.
Team F. And the question to you is, which of the following is correct regarding thrombosis of venous sinuses? Diplopia with 6 cranial nerve palsy specific for CVT. Headache is present in less than 50% of cases. Increased intracranial pressure is uncommon. Superior sagittal sinus thrombosis may produce bilateral thalamic venous infarcts. Seizures are more common in venous infarcts as compared to arterial infarcts.
Sir, diplopia of 6th cranial nerve is specific for.
I'm afraid that's not the right answer. Anybody in the audience who would like to attempt this?
Any audience response? Is it diplopia? Is it headache, which is less? Or is it increased intracranial pressure, which is uncommon? What is correct in this, all the statements? Who wants to? Yes, yes.
Please.
That is incorrect, already told. Superior sagittal sinus thrombosis will not involve thalamic.
That is commonly, it happens in deep venous system, thalamic. Okay. So,
correct answer is?
The correct answer is seizures. You know, in arterial strokes, seizures are not so common, but it is almost a hallmark of
venous strokes.
Venous strokes.
40% of patients will have this.
So the question passes back to team A. Are you ready? And the question coming to you is, a 51-year-old man presents with ataxia. An MRI was obtained and is shown here. Which of the following will most likely result from this injury?
Vertigo, nystagmus, right-sided ptosis and meiosis, vertical gauge impairment, right third and sixth nerve palsies, hemisensory loss to pain and temperature on the left side of the face, hemisensory loss to pain and temperature on the right side of the body. What is going to happen?
You have 10 seconds here.
Vertigo, nystagmus, and right-sided ptosis meiosis.
Very good. That's the correct answer. And why do you say so?
Sir, because the cerebellum is involved here.
Anything else? Any other clue? So, it is a Wallenberg syndrome. And if you could see in the medulla, there is a small infarct in the medulla as well. Lateral medulla, right. So, that next question is addressed to team B. Are you ready? The question coming to you is, a 34-year-old man presents with vertigo and neck pain after riding a very wild roller coaster. The examination demonstrates anisocoria with mild ptosis on the left side, nystagmus and reduced sensation on the left side of the face, left-sided ataxia. Which of the following is the best diagnostic test to evaluate the cause of this condition?
Is it ultrasound, carotid ultrasound, transcranial Doppler ultrasonography, transthoracic echo with bubble study, catheter angiogram of the cervicocerebral arteries, time of flight MRI of the circle of Willis? Concentrate on the clinical scenery and choose.
You have 10 seconds left. 5 seconds.
4.
Catheter angiogram.
Yes, is the correct answer. And why would you go for it?
Sir, it seems like a dislodgement, that's why.
Not dislodgement, but what happens with a very wild roller coaster, vigorous movements? What will happen to the arteries? What will happen? Dissection. Excellent.
Dissection. Excellent.
Chocolate there also.
Right.
Okay. Good.
So the next question goes to Team C. Are you ready, Team C? The question to you is: a 69-year-old woman presents to emergency department at 2 hours and 35 minutes from the onset of left hemiparesis and hemi-neglect. Her NHS score is 12. A brain CT scan shows no hemorrhage. Which of the following statements is correct regarding intravenous plasminogen activator (TPA)?
Is it the risk of hemorrhage with the TPA similar to placebo? Earlier administration carries a better prognosis and a lower risk of hemorrhage. There is no maximum dose. The use of TPA improves short-term but not long-term clinical outcome. It should not be administered beyond 2 hours from the onset of symptoms. This is the main treatment nowadays for stroke.
10 seconds are over. You are left with 10 seconds. 5 seconds.
For the use of TPA improves short-term but not long-term clinical outcomes.
I'm afraid that's not the right answer. It's open to the audience again. Anyone can raise your hand?
Yes. Earlier administration.
Excellent. Yes.
Excellent.
That's
Chocolate.
correct answer. Chocolate to the doctor.
Earlier administration.
The question passed to Team D. Are you ready, Team D? And the question to you is: a 72-year-old woman with a history of diabetes presents with a transient visual disturbance on the right side. On further questioning, she reports that she experienced a transient dimness of the vision of the right eye, progressing from the upper visual field to the lower visual field like a shade falling. This lasted for about 10 minutes and resolved on its own. Which of the following is correct?
This patient is having transient ischemia of the left occipital cortex. A transcranial Doppler will demonstrate increased velocities in basilar artery. The right ICA is stenotic with an atherosclerotic plaque. The left ICA is stenotic with an atherosclerotic plaque. Fundoscopy will demonstrate papilledema. What will be the answer?
Ten seconds are done.
Sir, the right eye says stenotic.
And why do you say that? Right eye says stenotic?
Sir, I'm not sure. This may be a retinal detachment.
No, your answer is correct. The right ICA is stenotic because this is a transient monocular blindness or causing amaurosis fugax. So I'll give you that answer. They get the correct answer for this. The question passed Team E. And you ready with your, the question is: a 40-year-old man presents with tinnitus, unilateral hearing loss, nausea, vomiting, vertigo. On examination, he has nystagmus, ipsilateral ataxia, ipsilateral Horner syndrome, and contralateral sensory deficits to pain and temperature of the arm, trunk, and leg. Which of the following is the most likely diagnosis?
Concentrate on all the clinical features. Is it AICA stroke? Is it pica stroke? Is it midbrain infarct? Is it occipital lobe infarct? Is it superior cerebellar infarct?
Option 2, pica stroke.
Pica?
Posterior inferior cerebellar.
I'm afraid that's not the right answer. The question passes to the audience again.
Yes.
Well,
why did you say?
Excellent.
Excellent answer.
He gets the chocolate there.
Great.
The question passes to
Team F.
Team F. And the question to you is: a 59-year-old woman presents with altered mental status, and there is restricted diffusion on the MRI, which is as shown. Which of the following is the most likely diagnosis?
Is it bilateral anterior choroidal artery stroke? Is it a stroke from occlusion of the recurrent artery of Hubner? Stroke from occlusion of the artery of Percheron? Stroke from the occlusion of the pericallosal artery? superior sagittal sinus thrombosis.
Stroke from occlusion of artery of Percheron.
Excellent. Excellent. What is artery of Percheron?
Sir, it supplies to the thalamus for the.
So this is the answer. It's a bilateral thalamic infarction, and it's a T1 branch.
It's a very variant supply. Only one artery supplies both the thalami, right? Okay.
Question now passes back to Team A. A 49-year-old woman with anxiety, depression, and hypertension and diabetes presents to the emergency department with.
Oh. Okay. It's just 10 seconds, do more. We should go.
Okay, the question I'll repeat again. A 49-year-old woman with anxiety, depression, hypertension, and diabetes presents to emergency department with a sensory deficit affecting her right face, arm, trunk, and leg, which started yesterday in the evening. The symptoms reached their peak on the morning of the presentation. There are no motor deficits on examination. Which of the following is correct?
There is no further workup is needed and the patient can be discharged from the emergency department. Given the lack of motor deficits, her symptoms are most likely related to anxiety. The most likely location of the lesion is in the cortex. Cardioembolism is the most likely etiology. Small vessel disease is the most likely etiology.
Small vessel disease is the most likely etiology.
Small vessel, yeah, that's the correct answer. Why do you say that?
Sir, because mostly the lenticular striate arteries are affected, causing the pure sensory loss of the entire capsule.
Very good.
You seem to be a master of lenticular striate arteries. He has answered the first question also correctly.
Yeah, the question now is addressed to Team B. And the question to you is, a 52-year-old man with history of smoking, diabetes mellitus, and hypertension presents with acute onset of left hemiparesis affecting the face, arm, and leg. He recognizes the left side of the body and acknowledges the deficits. His gaze is not deviated, which is the most likely location of vascular occlusion.
The trunk of the right MCA before bifurcation, lenticular striate branches of right MCA, superior division of the right
E. And your question coming up is, a 52-year-old woman presents to the emergency department with acute onset of right hemiparesis. A CT scan is obtained and is shown in the figure. Which of the following is correct?
The patient is at risk of vasospasm. The cause of symptoms is a lacunar stroke. The patient may need suboccipital craniectomy for decompression. Patient has a hypertensive hemorrhage. Patient has an MCA occlusion.
Look carefully at the image and you will get the clue. You have 10 seconds remaining.
Option A, the patient is at risk of vasospasm.
Unfortunately, that's not the right answer. Anybody from the audience? Anyone from the audience?
Very difficult one.
Yeah, you.
Wrong.
Hypertensive? Hemorrhage, no. What?
Yes, yes.
MCA, can you point to the MCA? Come to the stage and point to the MCA.
Point.
Come.
What's your name?
Come. Which?
Show it. Come.
Just try.
But you can put your finger.
Yeah, your finger. Yes,
Yeah,
excellent.
that's good.
Have you seen this before? This scan and a patient?
Great. Very nice.
Great. And the last question in the round goes to Team F. And the question to you is, a 59-year-old man with history of diabetes, hypertension, and hyperlipidemia presents with blood pressure of 60 by 30 millimeters of mercury and confusion. His creatinine kinase is very elevated with the MB fraction of 12%. His troponin is elevated and the electrocardiogram shows ST depressions in the inferior leads. After stabilization, he is noticed to have left-sided weakness, more prominent in the shoulder abductors and hip flexors. Which of the following is the most likely underlying mechanism of his weakness?
You have the clear-cut history, weakness from myopathy. Is it an internal capsule, lacunar infarction? Is it hypotension in the setting of a left internal carotid stenosis? Hypotension in the setting of a right internal carotid stenosis? Cardioembolic event associated with arrhythmia? What do you think it is?
So cardioembolic event associated with arrhythmia.
You just, you have to look at the heart scenario.
See, better the blood doesn't form instantaneously in the heart.
He has a left-sided weakness with prominent shoulder abductors and hip flexors.
Whatever it is, tell.
Hypotension in setting of left internal carotid stenosis.
Hypotension in the setting of left internal, right internal carotid artery stenosis. Should we give to him? Judge, you have to give? Okay. Judge said yes.
Why do you say the left? Why left or right?
So Team F gets
Left leg, yeah, paralysis, so it has to be right.
so Team F gets full marks for that, and
That ends the stroke round. Students, neurologists learned stroke by stroke. That's why we concentrated so much on neuroanatomy and clinical correlation of signs. I hope you have been benefited by this exposure to neuroanatomy. So, I asked Dr. Shripad to come on stage and conduct the second round, which is a clue round, and rules for clue round by Dr. Nitin.
So after the end of the first round, I would like to show the scores over here. As we can see, the leading team this time is Team A, which is
The protest observation, it's a request that last question should not be given to Team F.
Because the girl had already made an attempt, and because I thought it was not an easy one, I wanted to be a bit liberal, but it is unfair for the other participants.
Okay, students?
None of them got second.
Okay, you will have better chances. Thank you. You have to minus the last.
So as we can all see at the end of the first round, which was the stroke round, the clear leader is Team A, SKN Medical College with a score of 40 points. Second is Mymar Medical College with a score of 30 points, which is Team D. Team BJMC and AFMC are tied at 20 points each, and Team Bharti and DY Patil at 10 points each. But then, as I told you that this is just the beginning of the quiz, this is just the first round, which was the stroke round. Now, we are coming to the clue round, and there we all have a chance to improve our scores. So what is a clue round? A clinical case scenario is going to be given to the teams. Again, the rules are same, around 15 seconds you have to answer. If you are not able to answer, then you will be given a clue. If you are able to answer with one clue, then you get 20 points. If you answer without any clue, just by looking at the clinical scenario, you get 30 points. Scorer, please note. If they answer without any clue, then it is 30 points. With the help of one clue, it is going to be 20 points. If they answer with the help of two clues, then it is going to be 10 points. Even after two clues, they are not able to answer, then this is a round which is a buzzer passable round. So any team which wishes to answer can just immediately press the buzzer when they are asked to do so, that like, no, your time is up. And 1, 2, 3, and then you press the buzzer, whoever wants to answer. Okay? Is it clear?
How much does the buzzer get?
10 points.
10 points.
10 points. There is no negative marking. So it is passable by buzzer only to the other contestant for 10 marks, and there is no negative marking. So are the rules clear? Is there any question or any doubt? There will be 2 clues.
0 clue 30, 1 clue 20, 2 clues 10, and if the team doesn't answer, it buzzes, and the buzz guy gets 10.
There is no negative for the buzzer also. Even if you buzz it and you are not able to answer, still you will get only 0. It will not be a negative mark. Total there will be 18 questions. So 3 questions, every team is going to get 3 chances. And if they are not able to answer, then other teams also get the same chances. So total 18 questions are going to be there in this round.
And if nobody answers, then it passes to the this.
Yeah, if none of the contestants are able to answer, then it goes to the audience.
So, ये कहाँ से चालू करें?
इसमें है? Okay, one second.
I'm not touching anything. But I'm thrilled to see the clinical acumen of the third year students all across this Pune through the 6 medical colleges. My professor Dr. Sangle is here. So my twin, and I don't know. We used to be just, confirming our own clinical science when I was a registrar. So hats off to all of you.
It's not
Hats
opening.
off. नहीं सर आपने ये किया एक सेकंड मैं डबल क्लिक कर रहा हूँ हाँ बोल रहा हूँ वो दोनों तरीके से किया ये ओपन है क्या So again, I have to really congratulate all of you. Don't go by your marks. Looking at you, your understanding of clinical medicine, and more so your understanding of imaging, both CT and MRI. The guy who has picked up the hyperdense MCA, I am training my neurology PGs. Even there, I have to go to the emergency and show them the hyperdense MCA, and I am amazed. Oh, my third year student, I think soon I will be redundant. Gurti sir? Yes. Both are going to be redundant. If these guys come and themselves. Sangle madam?
We'll be always on the run to learn more and teach them.
Honestly. Amazing acumen. And the interest in neurology. I'm glad.
Clue round.
30, 20, 10. So 3 questions per team.
By rotation.
Yeah, by rotation. Passable by buzzer.
Right.
So 58-year-old male presents with a left side headache and neck pain that occurred during weightlifting. Beg your pardon?
No, no.
Yeah, वो तो ठीक है.
ठीक है.
1, 2, 3, 4 वो तो. He was concerned because he felt like his left eye was droopy. On examination, you confirm that he has slight ptosis of the left eye. What is the cause of his finding? Overactivity of the parasympathetics, impairment in the oculomotor nerve function, underactivity of sympathetics, underactivity of parasympathetics, or overactivity of sympathetics. It's very simple.
If you want a clue, then you'll lose marks.
Sir,
No. They have to ask. You ask if you want a clue.
Sir, one clue.
Press. Clue 1. Over elevation of the eyelid, such as fear. Depression of the eyelid may be seen in fatigue. You want to go back to the question?
Underactivity of sympathetics.
Very good. Excellent.
Excellent. So what is the sign because of?
Because of ptosis, there is
Partial ptosis.
yeah, partial.
Because of?
Sympathetic palsy.
Yeah.
We'll go next.
Yeah. Okay.
And then next.
Next question.
Okay, next.
So team B, a 76-year-old man who is referred for right eyelid ptosis and right pupillary constriction. He also mentions that when he exerts himself, he notices that the right side of his face does not seem to sweat like the left side. Using this information, which of the following would not be a probable cause for his symptoms? A tumor affecting C8 to T2 spinal levels, a lesion between hypothalamus and ciliospinal center of the budge, tumor in the right lung apex, large hematoma formation under the subclavian artery following attempted central line placement, and ICA dissection involving the mid-cervical region above the bifurcation.
There is a clue in the story.
Yes.
ICA dissection involving mid-cervical region.
So one clue I'll give you. Okay? Yeah. Answer. Yes. Because you have answered. If you have asked for clue, we would have given you. You have answered. So that's why this is the correct answer. The lesion between hypothalamus and ciliospinal center of budge cannot have the sweating absent.
Sir, if the question, she answers wrong, so like, is the question passed after that?
If a clues, only on clues.
Only if she,
Yeah.
she exhausts the clues.
Yes.
Okay.
If she asks for clue, only it passes. She didn't ask. So mind you, if you want to ask for a clue, please ask first. Okay? Once you listen the question, you want to have a clue, then you ask for clue. If one clue, second clue. There is no passing here.
So this question was based on basically the
Again,
anatomically
that
the.
question, we'll talk after
Yeah.
the question.
Yeah. A 58-year-old man. This is for team C.
No, it is not repeat. There are differences here. You will have to answer. 58-year-old man presents with a left side headache and neck pain that occurred during weightlifting. Okay, first question. He was concerned because he left his left eye was droopy. Slight ptosis. What other clinical clue helps in localization? What are the clinical clues? See, you are going to learn about everything about Horner syndrome here. So what is a clue that will help you in localizing this? Is it depression? Yes?
Left-sided facial anhidrosis.
How?
Because Horner syndrome basically is a triad of meiosis, ptosis, and anhidrosis.
Yeah, how is it localizing?
So if the droopiness is on the same side as the left side and anhidrosis is on the same side, so we can confirm that's the left side.
Your answer is correct, but not the explanation.
Your explanation.
Explanation is you get the marks, no doubt. The explanation is the fibers supplying the face, they deviate at the end of second order neuron. The three order neurons from the hypothalamus, the cervical spine, and the superior cervical ganglion, and from there, the fibers supplying face deviate. Yeah. Others will go up along the internal carotid artery. Right. So that's the answer. So he gets the point.
So between preganglionic and postganglionic, that's
okay. Yeah. The idea of these three questions. Next question.
Shall I go ahead?
This question, yes.
Yeah. So team D, ready? Yeah. Which of the following is true regarding the sympathetic pathway to the orbit and face? The oculosympathetic fibers travel with the maxillary division of the trigeminal nerve V2 to the orbit. The sympathetic fibers arise from the posterior hypothalamus. The ciliospinal center of the budge is located at spinal levels C6 to C8. The vasomotor and the sweat fibers travel to the face along the ICA, and superior cervical ganglion is located near the level of the subclavian artery. Which is true?
Which is true in all these five. So anatomically you should know where the center of budge is, ciliospinal center of budge, how the sweat fibers travel to the face. The quiz becomes difficult as the rounds progress. So much is at stake.
So we'll take a clue.
Yeah.
The pathway is spreading from the intracranial region to eye via neck. Okay?
Yes,
go
you
back.
can.
The ciliospinal center of budge is located at C6 to C8.
That is a wrong answer.
Okay, who pressed?
Team E. Team E? We said there is no pass here, no? After second clue only. Now they have already faulted here.
So, sir, actually, by answering the wrong, picking the wrong choice, they have lost their reason. So we can open it to the other 5 teams.
No, without marks they can answer. Without marks they can answer. We have already said if first there is no answer, first clue is given. Second clue is also given if they want. If they answer, the question is dead. It's over. Right?
Yeah.
We will not do anything more about it.
So shall it be passed to by buzzer round?
No buzzer round.
No buzzer.
If answer is given, no buzzer. If answer is not given, clue 2 is given also, then they can buzzer. Okay? Right. You can answer now. There's no problem. Yes, anybody wants to answer?
Yeah.
For chocolate. Go back to the question. Now you see. Which one? The sympathetic fibers arise from the posterior hypothalamus. What is true regarding sympathetic pathway in this? The budge is not C6 to C8. It's beyond that. The ICA travels. No, it's ICA, not subclavian. Okay, it's true. Okay, that's all. Next. So the facial anhydrosis, if dissection or other lesion extends proximal to the region of the carotid bifurcation, because sweating fibers travel primarily with the external carotid artery, would not be involved in the ICA dissection. Okay?
Absolutely.
Right. Next. Next. This is the diagram which I just, for interest sake, I have put it up. So all of you should learn Horner syndrome in detail and the sympathetic pathways. Next.
Yes, now it's the
Turn of which? Team E.
Team E. So question 5 for you. A 48-year-old man is found comatose after not being seen for at least 2 days. He requires endotracheal intubation on the way to the hospital and is admitted to the neurocritical care unit. His CT scan is shown here. Which of the following is correct regarding the treatment of this patient? Endovascular reperfusion therapy is the next step. Anticoagulation with intravenous heparin is indicated to prevent expansion of the stroke. Early hemicraniectomy improves survival. An intraventricular catheter should be placed. Dexamethasone should be started at a dose of 4 milligram every 6 hourly. Which of them is correct? E.
If you want a clue, please ask first.
Yes, go ahead and ask clues. You will only going to go on reducing 10 marks each clue, but you will at least get 10. First clue you want? Yeah. The management requires addressal to prevent an important life-threatening complication following a massive stroke. So here now we are just here to save life. Yeah, I'll show you again. What will save life?
If you don't want to answer, please don't answer. Ask for second clue.
Okay. So first we have already clued you that important life-threatening complication. Now we are offering you this. To manage this complication, we use mannitol and 3%, but these measures are insufficient, and then we go to the next step.
Want to go back to the question again?
Yeah, of course, I will show you that.
If you don't want to answer, don't answer, so that others can answer. It's a wrong answer. You got the clue. Why didn't you use that? Life-threatening. You look at the CT, what is there?
But if you put a ventricle...
There is no hemorrhage.
If you put a... Yeah, there is no hemorrhage.
What is there? There is a lot of edema there. What does edema? What do you want to do with the cerebral edema? Hemicraniectomy. Okay, absolutely. Right. So next question.
Yeah. So to the team F, I gather. Yeah, correct? Yeah. So a patient is admitted after suffering head injury. His CT is shown. Regarding this condition, which of the following is correct? The hemorrhage originates from tearing of a cerebral surface, bridging veins. The hemorrhage originates from rupture of the middle meningeal artery. It is associated with Charcot-Bouchard aneurysms. Lipohyalinosis is present in cerebral vessels. And coiling or clipping of the culprit aneurysm will prevent rebleeding.
Think.
So the hemorrhage originates from tearing of cerebral surface bridging veins.
Excellent answer.
Excellent. What type of hemorrhage is this?
So subdural hematoma, concavo-convex opacities.
Okay.
Perfect. Perfect.
Give them a big hand, please.
30. 30 for this gentleman.
Right.
Yeah. So again we go back to team A with the 7th question. A 45-year-old woman with no preceding history of trauma is admitted with sudden onset of severe headache and rapidly deteriorating alteration in mental status. Examination, she is drowsy, confused, moving all 4 extremities, but slightly weaker on the right side. No abnormal posturing is seen. Her brain CT is shown. Which of the following is the most likely cause of this condition? Most likely, arteriovenous malformation, aneurysm rupture, rupture of bridging veins, laceration of middle meningeal artery, and hypertensive hemorrhage. Remember, you have two clues.
First clue.
Yes. On clinical examination, there will be neck stiffness, even if there is no meningitis.
Go back.
Yes, yes. Sorry, I forgot that.
Sir, second clue.
Okay. In this condition, angiography is indicated within 72 hours, preferably. Angio, okay?
Sir, aneurysm rupture.
Oh, very good.
Perfect.
Give them perfect. Excellent.
Excellent.
So
Well done.
though late,
10
correct.
marks. 10 marks.
Okay.
Team B, so you all appreciated the subarachnoid hemorrhage.
Isn't it?
Yes. So team B, an overweight 36-year-old woman presents with 3 to 4 severe debilitating headaches per month for the last 2 years. The headaches are last 1 to 2 days. They are sometimes localized bifrontally, but more often localized to the right temple, right frontal region, and behind the right eye. There is often rhinorrhea and congestion associated with her headaches. She denies any auras or neurological features. The pain is usually a deep ache, but throbbing when severe. She sometimes gets some nausea, but no vomiting. She has to wear sunglasses and go to a quiet room because she can't function. What is the most likely diagnosis? Cluster, intermittent sinus, tension, idiopathic intracranial hypertension, you all know it occurs in overweight, migraine without aura. Now we are out of the stroke scenarios, and we are going to have to think of all or many neurological disorders. Here I think we are restricted
The
to
most
headache.
common disease is headache. Every young person should know all knowledge about headache.
So first clue.
Okay, okay. In this condition, usually the patients have a strong family history and the headache is relieved by sleep. Let's go back.
Pseudotumor cerebri.
Your clue. Why you didn't use the clue, beta? Why you didn't use the second clue? Okay, so what should I do, sir? Go ahead.
That's over.
Yeah,
Question is dead.
I know. Question is
So this is a migraine without aura. Family history is present, and migraine headaches are relieved by sleep. Okay, that's the reason that we put up this question, and the clue also is appropriately given. Next.
Absolutely. So team C gets question 9. A 26-year-old obese woman with borderline hypertension presents with worsening headache, which she describes as a bifrontal bioccipital band-like pressure and pain. Occasionally she experiences brief transient visual loss or graying, especially when straining, which lasts only seconds, but no photo or phonophobia. She sometimes gets nauseated and vomits when the pain is severe, and she feels that her vision is becoming increasingly blurred. Her fundus is shown in figure. What is the most likely diagnosis? Migraine, tension, new daily persistent headache, IIH, and posterior fossa mass lesion.
For idiopathic intracranial hypertension.
Oh yes, that's correct. I think.
Perfect.
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 Give them
So
big hand.
So the team seems to have identified all the features and also have identified papilledema. Yeah, great.
That's a papilledema.
That
and
is a
IIH,
papilledema.
obese lady. Right.
Great. In an obese woman. And classic transient visual obscurations. So team D is ready to receive the 10th question. A 52-year-old man fell 5 feet from the ladder and landed on his back. Later in the day, he began experiencing a bothersome headache located bifrontally. Other symptoms included stiff neck, nausea, photophobia, tinnitus, worsening headache on standing, and improvement on lying position. His medical history is significant for recurrent pneumonia and atrial fibrillation, for which he is taking warfarin. Which of the following would be the most common diagnostic finding of your suspected diagnosis? His MR image is shown in the figure. What is the most likely diagnosis? Number 1, early meningitis. Number 2, subarachnoid hemorrhage. Number 3, subdural hematoma. Number 4, carotid dissection. Number 5, low cerebrospinal fluid pressure headache.
What are you seeing on the image?
Yes. Use every word in the paragraphs. Each word and a phrase is going to take you towards it. That's not a clue, huh? It's already there in front of you. So I'm just saying use every word. Yeah, you can take. So normal CSF pressure is 70 to 180
H2O?
millimeters of water.
Or?
Or 7 to 15, whatever. 7 to 18. 7 to 15 Hg.
You want to go back?
And then we go back again now. So you've been given the normal CSF pressure as well.
So low CSF pressure headache.
Perfect.
That's very good.
Perfect.
Utilize the cue very well.
Yeah, absolutely.
Absolutely.
So yes, sir, you explain the MRI, sir.
The MRI is showing
Please explain, please.
the-
This is a very beautiful MRI.
There is, what are you seeing? All the meninges are enhancing. They are meningeal enhancement.
Yeah.
This is because of low pressure in the CSF.
Absolutely.
And
The whole
whenever a
thing is
fall
done.
occurs, the leak usually happens in the thoracic region. So there will be headache. And the features are very characteristic of that. Okay? Right, very good.
So team E is ready for 11. A 36-year-old man with a history of herpes simplex virus infection presents with a new onset epilepsy that you suspect is due to his prior encephalitis affecting the temporal lobes. The clinical features of seizures in mesial temporal lobe epilepsy may have all the characteristic symptoms except olfactory hallucinations, altered consciousness, complex partial seizures, automatisms, tonic posturing of one limb, fencer's posture. What is not there in the temporal?
It's a sequel of HSV encephalitis, affected temporal lobes.
Yes. So this condition may have déjà vu, a feeling of already experienced the present situation. And I'll go back to this.
So one of the characteristics is not there.
Of all these things. Yes. This condition may also have what we call jamayasvu, which means finding subjectively unfamiliar something we know to be familiar.
So you have to use your intelligence to rule out one thing of the four. The clues are given to include the other one, not this one.
Yes. So all these things are there along with four of these things. And the only fifth one is the odd man standing.
Tonic posture of
Wow, no, he's already said.
tonic posturing of one limb. Fencer's
Okay,
posture.
fencer's posture is a frontal lobe epilepsy.
Fantastic.
Fantastic.
Excellent. So as you know,
Second cue.
yeah, very nice. Is associated frontal. Temporal is characterized by automatisms, deja, and Jamayasvu complex partial. Fantastic. So here we go
to the F.
Team F. Ready? An 8-year-old boy brought to Neuro OPD by his parents They tell you that his teacher suggested that the boy should see a neurologist for poor attention. His EEG is shown in the figure and is characteristic of what type of epilepsy? Number 1, juvenile myoclonic. Number 2, absence. Number 3, just myoclonic. Number 4, benign childhood epilepsy with centrotemporal spikes. That is called as benign Rolandic because it comes from the Rolandic part of the brain. And number 5, Lennox-Gastaut. Now this is not really easy, but you can, figure out by logical ways. Inattention.
Inattention, child, right, in school. These are enough.
So, absence epilepsy?
Absence epilepsy is a wonderful answer. Excellent.
Absolutely. It may not be very easy for you guys
But-
to read the EEG.
But the absence epilepsies, they are very brief in children. They occur hundreds of times in a day. When they are in class, they are not able to pay attention to what teacher is. So there's a gap in their learning. That gap will make them scholastically down. So that's the importance. The teacher has really identified and brought excellent answer.
So we are going back to team A, sir?
Yes.
Yeah. So at 12 we are ready. 12-year-old boy with complaints of early morning falls, clumsiness, dropping objects, presents with a generalized tonic-clonic seizure. His EEG is shown in.
I'm sorry. I think he is not there in this. But with this history is okay.
So basically, even if you don't have early morning falls, clumsiness, dropping objects from the hand, and has also a generalized tonic-clonic seizure. His EEG is shown.
EEG is not shown.
It's okay. I mean, EEG you may not need to
Study
even
it.
report. Which of the following is the most likely? The options are similar here. Juvenile myoclonic, absence, myoclonic, benign childhood, again as I said, the Rolandic one, and Lennox-Gastaut.
You want a cue?
So juvenile myoclonic epilepsy.
Excellent answer.
Excellent answer. How did you work it out?
Sir, it is mostly precipitated by sleep deprivation. So early morning falls can be.
Perfect. Spot on.
Juvenile myoclonic epilepsy is a lifelong epilepsy. It has to be treated lifelong with low doses of drugs. So once you start treating, you have to treat for long.
I would not have done as a TMS.
Yes.
Very difficult. So team B, a 52-year-old man presented to the clinic complaining of a tremor. His wife had noticed a tremor over the prior year, mainly while he was at rest, such as while watching television. He also complained of walking slower, and his wife reported that his voice was getting softer. On direct questioning, his handwriting had gotten smaller as well. He was otherwise healthy and had no complaints of cognitive dysfunction. On examination, he had a moderate frequency rest tremor in the right hand with mild cogwheeling in the right arm. On gait examination, he had a slightly flexed posture and he swung his right arm less than the left. Finger tapping was slower on the right. Examination was otherwise unremarkable. What is the most likely diagnosis? Idiopathic Parkinson's, dementia with Lewy body disease, vascular Parkinson's, drug-induced Parkinson's, and cortico-basal ganglionic degeneration, which is another form of degenerative Parkinsonism.
Idiopathic Parkinsonism.
Excellent
Fantastic,
answer. Fantastic answer. Excellent.
Fantastic.
As an undergraduate to answer
Yes.
this is very, very nice.
How did you, on what basis did you make this? Yeah. So he has all the characteristic features. And remember, the idiopathic Parkinson's, although it also is a degenerative disease, can present asymmetrically, and the presentation is more with tremor. If anybody presents asymmetrically gradually with tremor, that is idiopathic, and you've done very well.
Parkinson's disease onset is asymmetric. Loss of smell is an early manifestation, and dementia is late. Okay, falls are late.
Absolutely. So ready for team now? It's team
C.
C. Correct? Team C. 56-year-old man presenting to the clinic with bilateral upper extremity rest tremor of 6 months duration. On examination, he had bilateral moderate frequency rest tremor, slightly worse in the right upper extremity compared to the left, but it is bilateral, and bilateral cogwheel rigidity that appeared to be equal in both extremities. He had significant bradykinesia affecting both sides of his body. He was prescribed levodopa, which had little effect on his symptoms. On follow-up 1 year later, he reported significant gait instability just in a year. Examination showed bilateral dysmetria and his gait was wide-based and slightly lurching. MRI shown beautiful MRI it is. What is the most likely diagnosis? Idiopathic Parkinson's, multiple system atrophy, progressive supranuclear palsy, primary autonomic failure, and cortico-basal ganglionic degeneration, which is another type, as I said, of degenerative Parkinson.
So it's multiple system atrophy.
Excellent, fantastic. Man, it's
So what
terrific.
made you think that?
So it's a Parkinson's patient who has developed cerebellar symptoms. So
Fantastic. And what do you see on the
hot
MRI?
cross bun sign.
Huh?
Hot cross bun.
Hot cross bun sign is excellent answer. It is
I
because
must say, Sashtang Dandavat.
we
Sashtang
can't
Dandavat.
answer this.
It is only
because
when
of
I became exam going in the MD that I started learning this.
it's because of
Fantastic.
degeneration of the perineal tract fibers. You see that, okay?
Well done. So D, ready? A 28-year-old woman presents with numbness and tingling in her feet. She was seen in the emergency department, and after no neurologic abnormalities were found, she was reassured and discharged home. 4 days later, she returns unable to walk. She complains of numbness and tingling from toes to just above the knees, and also affecting her hands. On examination, she has distal more than proximal weakness in her lower extremities, subtle weakness in her hands, ankle and patellar reflexes were absent. She recalls having a viral illness a couple of weeks ago. Which of the following is the most likely diagnosis? Guillain-Barré, MS, stroke, myelopathy, or myasthenia?
So GPS.
Yeah.
GBS is the correct answer.
Correct.
GBS.
I think with their talent, sir, I think this was an easy question, I must say.
But everybody is thinking that's a tough quiz, but these boys are really answering very well.
Absolutely.
GBS has got no diagnostic test. It is diagnosed by using criteria called Asbury criteria. Total areflexia is one of the important features which is present in this case.
Perfect. So team E ready? Yeah? You guys are ready? Yeah. A 49-year-old man presents with 2 months history of gradually progressive symmetrical proximal and distal weakness, paresthesias or reflexia. A chronic inflammatory demyelinating polyneuropathy is considered as the possible diagnosis. CSF shows WBCs of 25 per millimeter cube. Normal is up to 5 lymphocytes, as you can remember, and a protein level of 150, normally up to 45 milligrams per deciliter. Which of the following tests is least indicated for this patient? HIV, monoclonal proteins, hepatitis C, acetylcholine receptor antibodies, and EMG nerve conduction studies. Least indicated. A real tough one.
It's a clinical diagnosis, CIDP. One of the tests is not indicated in this.
Is not indicated.
Acetylcholine receptor antibodies.
Perfect.
Fantastic.
Perfect.
Why
Perfect.
do you say so? That is done in which condition?
Yeah, take them.
Myasthenia gravis.
Perfect.
So we are
perfect.
okay.
Why not
Excellent.
HIV? Why do you need HIV? Yeah, it's a CIDP, but yeah, even such neuropathies are seen, and they usually have white blood cells, which otherwise will not be seen in influx, such this thing.
Last question of this round.
Great. To
That's so-
team
Yeah.
F now. Ready? 65-year-old man with type 2 diabetes presents with right lower extremity pain and weakness. He reports that symptoms began with severe low backache radiating down his right hip and thigh. He then noticed a difficulty flexing his hip and extending his knee, flexing his hip and extending his knee. On examination, he has atrophy of the right thigh muscles and severe weakness of the hip flexors, adductors, quadriceps, and hamstrings muscles on the right side. Remember the group of muscles. There are sensory deficits in the anteromedial thigh. Remember this. His patellar reflex is absent on the same side. Remember patellar. And he has unintentionally lost about 30 pounds over the past year. Which of the following is the most likely diagnosis? The small fiber variant of diabetic neuropathy, the large fiber diabetic neuropathy, the diabetic autonomic neuropathy, the diabetic mononeuropathy, and diabetic amyotrophy.
Diabetic amyotrophy?
Perfect.
Oh, a perfect answer. Excellent. I also learned very late in life about diabetic amyotrophy, but these children are very good.
Amazing.
Very nice. Amazing. It's a nice. That finishes our clue round.
Yes.
And we'll pass on to the break, and Dr. Nitin will come back with the details.
So, very, very well played by all the contestants. The questions are really tough, but then the answers are coming within a flash of a second, and that really denotes their level of preparedness. And I am really impressed by the knowledge that all the candidates have here. Now, at the end of this round, as we can see, the clear leader here is AFMC, which was earlier at the second position and now is at the first position, that is with 110 points. Now Bharti and Navle are tied with 100 marks each. After that comes Mimer with 80 marks, BJMC 60, and DY Patil 40 marks. But then again, it's a quiz and anything can happen at any moment. And as you can all, as we all know in cricket, there is something which is called as the power play overs. Similarly, here now the round which is going to come is called as the power play or the rapid fire round. Here the questions will be asked to the participants. One team gets around 60 to 70 seconds worth time in which the questions are going to be asked to them. You have approximately 5 seconds to answer. If you answer wrongly, then you get -5. You have a chance to say pass. If you say pass, then we immediately jump on to the next question. If you answer it correctly, then you get 10 points. So if the question is asked, maximum of around 6 questions you will be able to answer in that given time. That is what we will see to it. But if you don't know any particular answer, then my suggestion to you is that you don't wait up thinking too much about it, because your number of questions are going to decrease. Because here I will ask Dr. Shri Hari to put a timer of around 70 seconds. And in this 70 seconds, maximum of 6 questions can be asked to you. So I urge you all that at least you hear out all the 6 questions. Once you pass, you cannot go back to that question. That is also one very, very important thing. So the rules are clear. If you have to answer, you answer correctly, you get 10 marks. If you answer incorrectly, there is -5 for the scorer. Now this is going to be really tough for scoring, right? Secondly, if you pass, then it is 0. It is neither positive nor negative. You cannot go back.
Sir, but if you select the buzzer and don't answer, then?
Sir, buzzer, that is in buzzer round. Okay. This is rapid fire. So here for 70 seconds, team A only will be asked questions. Okay. After that, 70 seconds, team B will be asked questions, like that.
You have to just answer plus 10, wrong answer
-5, or you can pass.
That's all.
Yes.
And the questions don't go to others.
No, it doesn't go to any other team. It's a rapid fire question, team. And I would request.
Come, Vinny, Dr. Vinny will conduct. Yeah. Sudha, you want to say something? Come. rapid fire questions. There are no slides. Please concentrate and listen. Okay? There is no slide. We'll have slides for budget round, but not for this. They need a break, I believe. They want to use washroom. You can go. 5 minutes. Can we start? Where is your partner? Chalo, okay. All set? Please settle down.
Stay with me. So to reiterate, this is a rapid fire. Each correct question carries 10 marks. An incorrect answer will remove 5 marks from your score. There are no negative markings if you don't answer. And this is passable only to the audience and not to the team members. So team A, are you ready? So when I say start, you start. And your time starts now. The first question is, name 2 branches of auditory nerve.
Vestibular and cochlear.
Correct. During digestion, what hormone is released from the stomach to suppress hunger? Is it found in the brain? It is also found in the brain.
Pass, pass.
Pass. Introducing the gene for neurotrophic factor into nigrostriatal pathway in mice help alleviate the symptoms of what disease?
Parkinson's.
Correct. A gene located on chromosome 14 and involved with Alzheimer's disease erodes for how many seconds across? A gene located on chromosome 14 and involved with Alzheimer's disease encodes for what protein?
Tau.
Incorrect. CAG is the genetic code for what amino acid?
Pass.
And with that, your questions are over. 10 seconds left, but we can't go back to the old questions.
You can tell the answers.
Yeah, so the correct answers, you gave the correct answer for the first question. For the second question, during digestion, what hormone is released from the stomach to suppress hunger? The answer is cholecystokinin. You answered the question regarding neurotrophic factors, Parkinson's disease. Fourth question, a gene located on chromosome 14 and involved with Alzheimer's disease encodes for what protein? The answer is presenilin 1. And the CAG is a genetic code for what amino acid? The answer is glutamine. Okay. Right. And to team B, are you ready? Your 60 seconds starts now. Question number 1, magnetic resonance spectroscopy is related to MRI, but instead of examining anatomy, it examines what?
Pass.
Pass. Question number 2, name the enzyme from an edible root that researchers can inject and be taken up by nerve fibers that can be later identified under a microscope.
Pass.
Pass. Question number 3. During the development, the neural tube closes at about what week?
Pass.
Pass. Question number 4. Multiple sclerosis is the most common in what region of the earth? What region of the earth? You can answer. Your time's up, but you can answer.
Pass.
Pass. So your time's over. I'll rewind to your questions. The MR spectroscopy examines the molecular composition and or metabolic processes. Name the enzyme for the edible root that researchers can inject and be taken up by nerve fibers that can be later identified under a microscope. It is horseradish peroxidase. Which week does the neural tube close? It's week number 3. Multiple sclerosis is more common in temperate zones. And the 5th question I didn't ask you, so there was no time. We'll leave. And the next rapid fire is directed at Team C. Are you ready? Your time starts now. The first question, what are triple screen and alpha fetoprotein plus? What is it? Triple screen, what is it?
They are enzymes used.
Anomaly scan.
I will give it to you. It is a prenatal screening test. Correct answer. Surgery to correct strabismus usually is performed during what stage of life?
Pass.
Pass. Tissue plasminogen activator is useful in the treatment of stroke because it does what?
Activates tissue plasminogen, TPA.
What does it do?
It breaks down fibrinogen to fiber.
So what happens?
Plasminogen.
What happens to the?
So the clot breaks down.
Yeah, correct answer. Unlike declarative knowledge, processing procedural knowledge requires what brain part?
Pass.
Pass. The time's up. So the question number triple screen you answered correctly. Surgery to correct strabismus usually is performed before the age of 4 years. TPA dissolves clot that you answered unlike declarative knowledge, processing procedural knowledge requires basal ganglia.
The procedural memory is stored in basal ganglia and cerebellum. Declarative memory is in the temporal lobe and cerebral cortex.
Team number 4, are you ready?
Yes, sir.
At question number, time starts now. Question number 1, at high doses, alcohol decreases the function of what receptors that recognize the neurotransmitter glutamate?
Pass.
Sonic hedgehog is important for the development of what part of nervous system?
Spinal cord.
Correct answer. How does cocaine affect synaptic transmission?
Pass.
Pass. What is the fastest an action potential can travel in the human nervous system?
Sir, the speed.
Yes.
So 120 meters per second.
No, if you can give it in kilometers or miles.
So pass.
Pass. What is the hindbrain, part of hindbrain that is important for precise timing?
Pass.
Pass. The time is over. Your first question was, at high doses, alcohol decreases the function of what receptors that recognize the neurotransmitter glutamate? The answer is GABA. Sonic hedgehog is important for the development of what part of nervous system? Spinal cord. You answer that. How does cocaine affect the synaptic transmission? Blocks the reuptake of certain neurotransmitters like dopamine or norepinephrine. What is the fastest action? What is the speed with which action potential can travel? It is several hundred miles per hour. So there was a recent quiz question where they said it travels faster than the fastest car, which is Bugatti, Veyron. And what part of hindbrain is important for precise timing? It is cerebellum. Team F, are you ready? Team E. Team E, your time starts now. First question, name the first MAO inhibitor which was found to help depressed patient. Name the first monoamine oxidase inhibitor, MAO inhibitor, which was found to help depressed patients.
Pass.
Pass. Working memory depends to a large extent on what part of the cerebral cortex?
Prefrontal cortex.
Correct. Aspirin prevents pain by preventing the production of what chemicals? Prostaglandins, correct. The surgical destruction of what two parts of the basal ganglia can reduce the symptoms of Parkinson's disease?
Substantia nigra and caudate nucleus.
Incorrect. No, both wrong. Incorrect. Name the reflex that stabilizes one leg when the other leg suddenly flexes due to withdrawal reflex. Name the reflex that stabilizes one leg when the other leg suddenly flexes due to the withdrawal reflex.
Extensive.
No, that's sorry.
The reflex extends the other.
No, what is the name? Name the reflex. You can pass. Pass. Time is over. The correct answers are, name the first MAO inhibitor. The answer is iproniazid. Working memory depends to a large extent on the prefrontal cortex. Aspirin, you answer that. Prostaglandins. Surgical destruction of which parts of basal ganglia reduce symptoms of Parkinson's? The answers are pallidum and subthalamic nucleus. And the reflex that stabilizes one leg when the other leg suddenly flexes due to withdrawal reflex is crossed extensor reflex. We asked the name. And the rapid fire is now directed at Team F, and your time starts now. First question, corticotrophin releasing factor is released from what part of the brain?
Hypothalamus.
Correct. On a daily basis, what do cortisol levels peak in the body? When? When?
Sir, mid-afternoon.
Wrong. Name the source of input that goes directly into the suprachiasmatic nucleus and reset the circadian clock. Name the source of input that goes directly into the suprachiasmatic nucleus and reset the circadian clock. During the development, a primitive forebrain can be recognized by what week? Pass. Where do neurons carrying touch information synapse after passing through spinal cord? After spinal cord. Thalamus, correct answer. What do you call transient attacks of? What do we call transient attacks of paralysis while awake that can be triggered by emotional experiences? What do you call transient attacks of paralysis while awake that can be triggered by emotional experiences? Pass. And your time is over. So that question where there's a dispute, should we give them or not, judge?
They had said cuneatus and gracilis first, which was the wrong answer. So then they changed it to thalamus. So technically it should be negative marking. Sir, initially also it was after crossing the spinal cord in the question.
So
that's all for the rapid fire. May I request Sripad to come for the buzzer round? Buzzer round.
Since you had already answered, and since that was a wrong answer, because you have to listen to the question, and if the question is not clear, you can again ask to repeat the question, which you had done, I think, a couple of times. So you could have done that here also. So therefore, we are afraid we have to give you -5 on this. Now, at the end of this round, the scores are Team A 115 points, Team B 40. Now, the leading team is Bharti with 120, team D 90, team E is 75, and very, very close contest, AFMC team F 110. So right now the top three teams are BVDU, SKNMC and AFMC. And now
The final.
the slog overs are going to come. And now there will be total 10 questions which are going to be asked in this round. This is a buzzer round. If you press the buzzer and you fail to answer, or if you answer incorrectly after pressing the buzzer, then there will be negative marking. So now let me tell you how much the points are there. Each correct answer will give you 20 points. Whereas if you press the buzzer and if you don't give any answer, or if you give a wrong answer, then there will be negative 10 points. The question is passable only to the audience and not to the fellow contestants. Is it clear? If you hit the buzzer and if you answer it incorrectly, or if you do not answer it at all, then it is going to be minus 10. If you answer it correctly, it is going to be plus 20 for you. So 10 questions are there, 200 points are at stake, and let us see who now takes the lead.
Sir?
The first question.
Sir?
Yes, there are some doubts.
So the buzzer will be after the entire question is read, or will you say 1, 2, 3, or like?
Whenever you want, you can press. The question will immediately stop if you press before the question is completed, and then you have to answer with that much amount of information what you have got.
So here there is no 1, 2, 3.
Here there is no 1, 2, 3. As soon as you feel that you are confidently able to answer, you should press the buzzer.
Yeah, because it's for the first buzzer. The earlier you do, the better. Yeah.
But my request to you is please hear out the question, because if you miss out as soon as you press the buzzer, we are not going to speak anything more on that topic. Okay? Question will be displayed over there.
एक स्लाइड में सब आ रहा है एक स्लाइड हाँ बस इतना ही Shall we begin? All teams, audience, everybody is ready? Yes?
First question.
First question starts now. Huntington's is characterized by the depletion of what neurotransmitter?
Glutamate.
Glutamine.
So,
It's wrong.
no. Minus 10.
Next, GABA.
It's GABA. Question number
2. All set.
Gonadotropin releasing hormone.
Yes.
I think it's TME, na?
Yes.
Yeah.
Okay, that's correct.
Yeah, that's
FSH
correct.
and LH. Show the slide. Next slide.
Yeah.
It will come. Press again. That's FSH and LH. Okay.
Perfect. Let's move on to
Third question.
3.
Be ready.
Name the part of the brain. Perfect.
Hippocampus.
Hippocampus.
Yes. Again gets plus 20. Super. Super.
Next.
Ready for question 4. Name the syndrome characterized by sleep attacks, premature entry into REM, and
Narcolepsy.
super.
Excellent.
Excellent. Excellent. Move on to question 5. Amygdala and septum are part of this group of brain structures that regulate emotion. Super.
Super. Limbic system.
Super. You're scoring, sir? Are you getting enough time to score? Super. So question 6. Name the nucleus that acts.
Suprachiasmatic nucleus.
Excellent.
Super. I think they are horrible at anatomy. Sir,
We
should retire. Anatomy professors. I think they are doing an excellent job. Question 7. Nicotine works by stimulating the... Yeah. Go ahead.
This is acetylcholine receptors.
Super. That's perfect. That's perfect.
Time.
So that's okay.
15 seconds. 15
That's
seconds.
Okay. That's okay. Super. So here you are, the explanation. Shall we move on to 8? Go ahead.
Endorphins.
Yeah. We have to give them. Super.
Super. Excellent.
Superb. Superb. That's it. That's it. Even the pain therapist will retire, I suppose. Question 9. Question 9.
नहीं
काय को स्कोर अभी यू आर डूइंग ना अभी क्या करना है
Others should be worried.
सिक्सर मारे तो सिक्सर मारो उसमें स्कोर बोर्ड का क्या है लेट्स मूव टू 9 पे अटेंशन एवरीबडी नेम अ कॉग्निटिव डिसऑर्डर गो अहेड या
Horoscope psychosis correct answer.
Super. Others, fast hand, fast finger, whatever. Use your hands fast.
Last question.
Last, sir, 10 ke 20?
10.
10. Last opportunity for all those who have, have to catch up. Teams other than E.
Serotonin.
अरे मुझे तो समझने दो
क्या? What is that? Name the monoamine neurotransmitter form.
बराबर है
Yes,
सर
बराबर.
बराबर है
Excellent.
ये दोनों के रेसिडेंट रोल के बाद
We have seen some amazing slogging over here. Amazing slogging. अभी डिस्प्ले मत करना स्कोर डिस्प्ले मत करना BJMC has really done some amazing slogging in the end. So before we disclose the before we discuss the winners and the runners up and all, I would like you to display the trophies which we are going to give. Take a table. Please squeeze the trophies के ऊपर रखो. ये इधर पे रख दो ना ये टेबल इधर. और इधर से हट जाइए यहाँ से थोड़ा इस तरफ आ जाओ थोड़ा इधर से हट जाओ. So the winner is going to get first prize.
They are correct. But they changed the stance and gone to thalamus.
But sir, it was because we disowned the answer gracilis and cuneatus. It is because of that they had to think of the second option, and even the second option, which is the thalamus, they have answered correctly. So actually, in theory, both answers are right in that way, and if they have answered both right, as a judge, I would consider that they deserve this mark.
That points can be added. Please add those 10 points there. ये मेडल्स जो हैं ये यहाँ पर जितने बैठे हैं उनको ही मिलने वाले। So certificates पण ठेवले. So other than these trophies, the first rank, that is winner, second rank and third prize, they are also going to get some attractive cash prize. And all the participants are going to get a certificate. So whoever is there who has participated in that MCQ exam, you all will get a certificate. All the students who are sitting over here, they get a medal, and the first prize and second prize and third prize are going to be these trophies. I would request Sange ma'am to please come and say few words about how she felt about this quiz.
Just one sentence I want to say. I'm feeling so sad to be on the judge side and not on the side of the participants after seeing the trophies. That also is true.
Yes. I was amazed with the active involvement of the students, especially undergraduate students. I think they have all the facilities, but then use of those facilities is very important. Now, when we were students and undergraduate as well as postgrad, we never had social medias or internet access to us. Now they have all those facilities, but how to use them and how to take the advantage of them, those facilities, I think they have done a wonderful job. I congratulate all the students, not only undergraduate participants, but also all the undergraduate students who have come here gathered in large number. When we were students, we were very afraid of neurology. When we joined medicine, even first year neurology was very difficult for us. When Dr. Wadia's clinics we started attending, then we started learning neurology, and then that is how we started liking neurology. Now, today the quiz which is organized by Dr. Gorthi sir and his team, and active participation, involvement by Dr. Nitin Gadkari, I just requested Dr. Abhijit Dasgupta, who was BJ student, who did DM neurology and joined here as a lecturer in neurology. Very honest, humble, and very sincere hard worker. Unfortunately, he died of cardiac sarcoidosis. And in his memory, Dr. Gorthi sir and Dean and Director, they allowed us to start. This first prize will be given to the participants in the name of Dr. Abhijit Dasgupta. So, and it is not my credit, but he happened to be my PG student. I have, in 2006, he was my PG student, and he did his topic on clinical profile of myopathies. His active involvement was so tremendous. He used to go personally, used to collect the muscle tissue, used to tie on the cover glass, and then send it. So, and not only at BJ, but he used to take those slides to AFMC, electron microscopy on request. So he was a tremendous worker. If he would have been here, he would have been most happy. His parents were supposed to come today, but then he was the only son, and I don't think they will be able to attend this function, but they have requested me, they have sent a message just now that send us the photograph of who were the winners of trophy, Abhijit Dasgupta trophy. So still they have a association with Bharati, and they will be very happy to hear about this. So I think congratulations to whole team, and not only team, but also to the organizers and Dr. Gorthi sir, Supriya madam, who has helped everybody, and Dr. Sripad Pujari as well as Dr. Wilson. I think I have already done vote of thanks, but then sir will announce the winners and everything. The further proceedings, I will hand over the mic.
Thank you, ma'am. Thank you very much. Ma'am. Third position, score 125, AFMC. second position, SKNMC, 145. 95 or 45? 145. The topper of the quiz is BJMC, 215, first position. Oh, well done.
मेडल सबको दे देते हैं पहले मेडल सब please sit down. I would ask other participants to please come on the stage and collect their certificates first, and then I would request all the teams to be seated over here. First we will give medals to all the participants, then the third prize will be given, photographs will be taken, second prize, and then the first prize. Third, second, and first also take home along with the cups a cash prize. So yes, participants are there who had given. So I will just call out the name, they can just come. Riya Singh. Dr. Akshat Khare. Dr. Astha Selot. Dr. Srinivas Cheluri. Dr. Param Kadam. Yes. Dr. Alisha Sheikh. Dr. Harshada Shirshat. I think she bagged most of the chocolates. Dr. Sneha Pukale. They just lost by very few points in the MCQs rounds, elimination round. Dr. Sagnik Talukdar. Dr. Sudhanshu Kumar. Dr. Varun Menon. Dr. Yash Majithia. Dr. Dian Magdum. Dr. Shubham S. Khernar. Dr. Mihir Jitendra Lahoti. Dr. Amod Majumdar. Dr. Meg Shaligram. Dr. Johan Joseph. Dr. Advait Melinkari. Dr. Mukta Chidre. Dr. Shubham Chug. Dr. Piyush Jaju. He is the master slogan. Dr. Divya Redkar. And Dr. Dheeraj, Ajmer Dheeraj. I would like to request Dr. Dulari Gupta ma'am to please come on the stage to give medals to all the people who have cleared the elimination round and have qualified for the stage round. I request Dr. Shilpa also to come on the stage and give the medals to this side. नहीं नहीं मैं देते जाता हूँ. Now I would request team AFMC, who is the third place winner, to please come on the stage. And I would request Pujari sir to please come and give the prize for third place, the third place trophy to team AFMC and this and the cash prize. Yeah. हाँ ये third prize वाली है सर. I would request Dr. Prajakta to come and hand over the cash prize to them. For their convenience, we have already divided the cash prize equally into two envelopes. For second prize, I would request Dr. Wilson sir to please come on the stage. The second team is team SKNMC with a total of 145 points. For cash prize, wait. For cash prize, I will request Dr. Swati ma'am to please come and hand over the cash prize. आधा किया हुआ ऑलरेडी हमने दोनों एनवेलप में. And the winner of today's quiz, the stealer of the show, one who have performed exceedingly well in the last round, and not only in the last round, in all the rounds, in fact, but in the last round, they just, anyone just couldn't match their speed. And that is Team BJMC. So I would request Gaurav sir to give the first prize to BJMC. And I would request Supriya ma'am and Gurti sir to please hand over the cash prize also.
This honor to be done by Dr. Nitin, who's the yes.
I would request all of you to have tea and refreshments before we all disperse. But before that, let's have a group photo. Yeah, yeah. You all can start having tea and refreshments.